Okay, Dr. Deuk Majan, it's March 30, 2022. We have a cervical laser, and our patient has a massively thick neck. I was hoping it wouldn't be so, but it is very thick, and we're going to do our very best here. Shot. 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 AP quick AP. So I was looking at his neck, and I don't know if I can get all 4 discs. We're supposed to do 4. That looks good. Back to a lateral. Quick lateral. Very good. Shot. I'm sitting right on the shot. 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 You can see the bone spur is pushing me down. Shot. Let's just get a quick AP. Coker. I'm going for the 4-5 disc first, and I'll try to work my way to other discs after that. The issue with him is he's got an incredibly short neck. That's in the middle. That looks good. Let's go to a lateral. I should be able to get, I don't know if I can get all 4 discs. And I told the patient that ahead of time. He's got a massive neck. What's going on with his head? Are you flexing him?
Yeah.
I don't want him flexed. I want him extended, if anything. Extended and inline. All right, yeah. So we're looking good for this level.
I just left him. He has retired.
Really?
This guy's a big guy.
You want me to get one of the girls to come over there and help you? Huh? We need to work on your hand strength. All right.
How's my hand strength? Huh? How's my hand strength? Good.
How about endurance? Endurance. AP. Let's see what we got here. I can tell you the next one's going to be interesting. Our patient has a case of what's called DISH, diffuse idiopathic skeletal hyperostosis. That looks good. Yeah. So we're entering the disc in the midline. He's got some scoliosis as well. But we're heading off to the foramen right where we want to. Of course, it's an odd angle. Shot. Now you can see from his preoperative MRI that he's got some bad stenosis and that he has changes in his shot in his spinal cord as well. Shot. All right, let me see something here. Am I just up against the end plate? I'm not able to get my dye in. Shot. So why am I not able to get it? It must be embedded in the end plate. I'm going to pull it back a little bit. Shot. Let's see if that works. Let me have the guide wire. Once again, you can see C2 at the top. Then you got 3, 4, and we're at 4-5. The number 4-5 disc. Shot. And I need to get some dye in here if I can. If I can't, it's not the end of the world. This patient has, on a scale of 1 to 10, he's got about a 10 out of 10 difficulty neck. All right, shot. And that's why we had some talks before surgery. I wanted to make sure he understood we're going to do everything we can to do this endoscopically, but at some point we may not be able to. A lot of scar tissue. Shot. That's it? All right. All right, so I'm going to try to advance a little further and see if that will help. And we're good on the inline traction, by the way. All right, so guide wires in. We'll make our incision. Going to give him a little numbing medicine first to numb up the skin. Blood pressure's good. That's perfect. Why is that sticking to my hand? You got to watch those labels. I'm glad you're labeling everything. The incision is 4 millimeters for the surgery. It's a small incision. Shot. I'm going to take this spinal needle out, leave the guide wire. Shot. So the guide wire is sitting inside the number 4-5 disc. This will be the first disc we go after to fix endoscopically. This patient didn't want a fusion. We talked about it. He'd been offered it before. And he came to Florida to try to do the endoscopic. Shot. Endoscopic surgery, just so you know. Let's go ahead and run our video animation. Flynn, show the audience what, show the audience first of all, why do herniated disc cause pain? It's due to inflammation. Show them that video as we get into this first disc.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
We were just saying the nice thing about this patient's spine and neck is that I was worried the spine would be so far back from the front of the neck I wouldn't be able to feel it, but I was able to and safely get in. The downside and the only thing that concerns me a lot here is that his neck is short. So his window of operation for me to get in and move around is very narrow. Shot? All right, so we're pretty much in the midline where we want to be. And I'm wondering if we can advance this with a mallet. Shot? Do you have that tube? Yep. Let's see what we can do here. Is that the guide wire sticking out? Yeah, it is. So, shot. We're going to do our best here. Shot. That's pretty good. Shot. I think we're in. And shot. Yeah, I'm going to take the guide wire out. And we'll just finish advancing this dilator. Shot. Yep. That's going in. We need to get it angled down a little bit. Shot. That's better. Shot. Let's see if we can get our discogram done. Let's have a guide wire. I gotta clean the stuff out of the end. It's probably jammed up. Shot? Shot? Good. Now maybe we can get a discogram now that we're back enough in the disc towards the tear. And my feeling is this patient's discs are so scarred up. We had talked about that as well beforehand. That possibility. Shot? Alright, so not much coming out. He's watched many of my surgeries. Shot? And he knows, he's seen me encounter issues. So this is all the blood we've lost so far. Alright, I've got to try to angle this down a little. Shot? He's nice and relaxed?
Yes.
Doctor? That's it? Is that where we are?
Yes, sir.
Let me have one more shot. Let me just see for sure. Okay. I'm going to try to go back just a little bit further. Shot? Yeah. All right. Can you give me a little inline traction, please? Whenever you're ready. So it's like this. It's not flexion. It's a little slight extension and more inline. 1, 2, 3. All right, that's about as good as we're going to get it. And we come over with the tube. Shot. So that you can feel the tube is right up against the front of the spine. That's great. We're going to advance the tube down. Thank you, Luis. A little inline. Shot. Shot. I can see the tube moving. It's doing what I want it to do. Shot. Again, this is a very collapsed disc space, so shot. I'm going to have to try to move. There's really virtually no movement at this disc right now. I'm trying to create some movement by bringing the tube down. Shot. By spreading the bones apart a little bit. The bones are just squeezing so hard onto this tube. All right, let me think. Now that I've opened the bones up apart a little bit more, I'm going to try to advance this dilator. Shot? Yeah, there it goes. All right, and now I need a tube impactor again. And he's completely relaxed, right?
Give him more too.
All right, good. So I want his muscles relaxed. That's what my goal is. Keep his muscles very relaxed. Shot. By having the muscles so relaxed, I can shot. Is that it?
Yes.
All right, so let's go take a look at what we got. I'll need to get this out. I don't know about that. Is there no other way to get it out?
He's completely relaxed.
Can you give me a little inline?
Sure.
You got it? Nice job. That's it, we're good. All right, let's see what's back there. I'm hoping we can start removing the herniation and releasing the scar tissue at the back of the disc, and that'll allow a little more movement. You'll see that. I'll be able to move the tube, and I'll be able to move it left and right and kind of get everything cleaned out back there. It's just full of arthritis. That's the problem. Are we okay there? Yeah, this is definitely not an easy one. And I knew it wouldn't be easy when I met the patient, and he knew it wouldn't be easy because he's watched enough of these surgeries. So, is the scope on?
Stop on, please. Thank you.
We don't have enough light, maybe. I need to focus it too. There it is. All right, so we're looking at look at all that scar tissue and bone right there. Just it's calcified bone spur scar tissue right at the back of this disc. Are we at 20? So here we go. We're just going to get started removing this stuff. This is all abnormal tissue, totally abnormal. You see that pink tissue to the left? That's the end plate. And then there's another end plate at 3 o'clock. And there's herniation right there. I got a little bit of blue dye came out. So that's bone spur. And you see I'm working beyond the tube. I'm going beyond it. There's a piece of herniation right there. There it is. Came out. Bam. Nice, huh? It's the little things in life that matter, right? It's the little things. The little joys. Like little pieces of herniation coming out. That's what gives me joy.
You want this better? Are you good?
But the screen, yeah, you can bring it closer.
Just the screen, yeah, we can.
Now right now I'm trying to move, oh gosh, there's so much shaking. That's good, right there. Yeah, Luis has to be able to see it too. Thank you, Jordan. All right, there's no movement of the tube. I cannot move it. I'm trying, but it's so stuck in there that we're gonna have to remove a little more herniation before I can actually move the tube. It's all scarred up right here. Man, this is absolutely one of the worst I've ever done in terms of how severe the arthritis is. Now, if I had fixed this patient's neck, 10 years ago, we wouldn't have all this. This would have been repaired and done. But people wait, and they wait for good reason. Many of them wait because they don't want to have fusion, and that's all that's available to them. And they wait for something better to come along. Some people wait just because they don't believe in the technology is where it needs to be. But this patient found us at Deuk Spine and chose to have this procedure done over a fusion. All right, back the other way. We're just going to go back and forth, and I'm going to hopefully get some movement. There's a little bit of movement. And look at this, is all scar tissue from inflammation, calcified scar tissue. So it's a herniation. It's nucleus pulposus that's sitting within the annulus, and quite literally, as it sits there, it creates an inflammatory response, inflammation we call it, within the annulus. And that inflammation just causes so much pain, but also it causes scar tissue and bone spurs, and that's what we got right here. I'm removing herniated fragment like that right there, and I'm removing scar tissue, and I'm removing bone spur. So the targeting beam is too red. Can we turn the targeting beam down? It's just too much red. It's I'd like you to turn it down. Another notch. Maybe one more. That's good right there.
Thank you.
Thank you. Yeah. This is all arthritis here. All. Amazing. And now you can see the tube is moving, okay? It's like I said, we do this all the time. We go into a disc that hasn't moved in years. It's just locked in there. It's like rusted together, the two bones. And then we start removing this stuff. And next thing you know, there's a herniation right there. We got movement. So what's different about this surgery? Why don't we show the audience? We're back, obviously, right? Gentlemen?
Yes, sir.
Let's show the audience a side-by-side comparison of what the alternative surgery is. Fusion.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before release to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Still working here at the back of this C4-5 disc, and I can tell you this is all just like a giant field of boulders. Calcified herniations and bone spurs galore. And I've been using the laser, I said, to drill. We're drilling. And it's going well. He doesn't have any soft disc herniations. They're all hard. They're all old. They've been around a long time. All this is scar tissue over here. I was working on that while you guys were watching the video. All scar. Look at that. There's a piece of herniation right there. Okay, so that's going to float out. And then I've already worked on his left foramen. And now I'm working on the right foramen. He's got narrowing on both sides, foraminal stenosis. But it was really bad on the other side. And you can see I'm working beyond the limit of the tube. The tube I couldn't get back any further because the disc is so scarred together. The bones are so scarred together I couldn't get further back with the tube. But I'm getting further back using the scope. And I'm creating some movement here between the bones. So you can actually see some movement. Back to me. And what's moving are the vertebral bodies at the disc. So the disc is actually starting to move. When I first came in, there was no movement. There's all scar tissue here, calcified fragments of herniated disc. These are all herniated disc fragments. They're very calcified, very, very hard. They're like little pebbles. Okay? Totally abnormal. That's the foramen below me. And this is the source of a lot of his pain. Oh, just herniation after herniation coming out from this one disc. We've only done one disc so far. We're going to do the other ones as well. I think I can get at least 3 of them. That's what I'm hoping for. I'm going to try to do all 4. But that bottom one, it just disappears down into the base of his neck. And if I can't visualize it, I'm not going to be able to do it. So this is the foramen once again. And you can see how effective the laser is at removing bone spurs. Really good. Now, for those of you who have watched me do these surgeries over the years, you can probably tell from this surgery, this is a really, really, really advanced degenerative disc. And on top of that, he has this condition called diffuse idiopathic skeletal hyperostosis, or DISH, we call it. And that's a real problem, you know. and mostly up in the front. Doing all right? Anesthesiologist says he's doing really well. The patient is. So I'm going to clean up this foramen just a little more, and then we're going to be done at this level. Those are bone spurs and scar tissue sitting inside the foramen, right where the nerve is. And I want to open that up. Irrigation good, guys? Looks like we're out. Thanks. There's another herniation going up and out. A little bit of bleeding from the bone spurs. Can't do surgery without some degree of bleeding. Fortunately, this surgery is minimal. All right, you can see how rocky this is. This is totally abnormal. It's like his discs are trying to fuse themselves. Okay? From the amount of inflammation being so severe. They're definitely not fused, in case you're wondering. But you know, to do fusion in the spine or anywhere in the body with between bones, you need inflammation, and he's got plenty of that. So the first step of fusion, he's got down. Really good. I think we're just about done here. Now, one thing he's going to have is more movement, because all that scar tissue that was holding these bones together, keeping them from moving, we've just freed it up. We've gotten now probably about 2 degrees of movement in this disc. So he's gone from 0 to 2. If I do that for all 4, then he's going to get 8 degrees of movement. Doesn't seem like much, folks, but when you're limited in movement, every little degree counts. You know? Every degree counts. Back to me. More herniated disc, degenerated disc coming out. Just about done here with this one. Let's see if I can float it. I'm gonna have to grab it out.
Scope on, please. Thank you.
So after this, I'm gonna try to do
Okay, we haven't done it.
probably, there's a piece. I haven't decided yet.
Scope on.
I may try to do the one above, may try to do the one below. I'm going to look at his neck. Scope on. Lights off. Okay. Looking good. A few more little pieces of herniation. Again, this is all abnormal. I haven't found a single normal area in this disc, just so in case you're wondering. Not a, huh?
Complaining of third and fourth finger numbness.
Third and fourth finger numbness.
Primary, both sides.
Yeah, there, that just came out of the foramen, another herniation. Yeah, there's another one. So this is going to get the pressure off the nerve.
So that's according to what his disc disease, right?
Huh?
That's right where his disc disease is.
Oh, he has four discs. But his problem isn't just the nerve, it's the spinal cord. If you look at his MRI, you can see areas where the spinal cord is also getting compromised. So my goal is to get the nerve and the spinal cord decompressed. There's another herniation coming out. So far, as bad as this disc looks, folks, the surgery is going better than I expected it to for him. So, everything okay, Luis?
Yeah. Just trying to push it.
Me too.
Yeah.
Luis and I are completely leaning into this. He'll have a little bit of bruising on his chest because we're trying so hard to get everything cleaned out. We don't want to leave anything that might cause problems for him. You can see the nerve down there, it's decompressed. That's way down there, right there. So, that's a little uncinate process hypertrophy. We're pretty much done. I don't need that. Let me have the dilator. So now we got to make our way to the next disc safely. I'm going to use a little antiseptic. So this is sticking on my glove, and the antiseptic is nice. We've never had an infection. Don't want one. I'll take another one of those. You have plenty of irrigation, right? Yeah. And I think this has a little stuff in it. Gonna have to pipe clean it out. Now we've never had an infection with a laser surgery. Dilator. I'll take the dilator back in a moment after you clean it out. Alright, so we're going to need to get the fluoro back in. And just so everyone can see what we're doing, what do you want with this one? Here? Alright, let's go ahead and get the fluoro back in. Watch the laser. Now I need to use this fluoro. Fluoro is an x-ray machine because that's how I guide my tools and I learn which level that I have to go to. It's called localization and navigation. Navigation is moving surgical instruments around in a patient's body. We call that navigation. You are navigating to a place that you want to treat. So we use the x-ray machine for navigation, and we also use it for localization. All right, take a shot. It's too low. So we're going to use this fluoro now to navigate my instrument to the next disc that I'll be fixing. All right, and I think we're going to go down. Easy now. I want to go down to the next level, so let's try that. That next level will be 5-6. Everybody ready? So the first thing I'm going to do is take out, I'm going to leave the dilator. I'm going to take out the tube. And Luis, I need you to look at the tube and make sure it'll be able to come out. Ah, it's sliding out, Sean. So that's a good sign. It can't be bent that bad. Right? Watch that. All right. So, let's see where we are. A little bit overexposed. Let's see where we are. All right. So you can see the challenge here. I've got to take this dilator out and head down south. So what we're going to need is a little shoulder pull. Oh, okay. Whoa, not too much. Who did that? You can't pull hard and fast. It's got to be slow. Shot. Let's see what we got. All right. Somebody's hands are in the way. Luis, that's yours. Shot. Yeah, perfect. That's perfect, guys. All right, I'll work as quickly as I can. Shot. I'm right on the edge. Shot. Could feel the bone spur. All right, shot. I'm outside. Good. I'm going to make my way down. Shot. I need an AP. Coker. I got it. Everybody stay where you are. Don't release anything. We're almost done. You guys are all doing fantastic. I really appreciate it. Perfect. Lateral. So I'm in the middle, in midline. That's where I want to be. And I'm going to move further south. I'm feeling. Shot. Halfway there. Shot. Shot. I feel like I got it. Yeah, we're there. Shot. That's beautiful. I need an AP now. Everybody stay. I need 30 seconds more. My team is doing an amazing job. This is where they get their workout. Lateral. That's perfect. Let's go lateral. So I'm sliding along the front of the spine, quite literally sliding along the anterior longitudinal ligament. Perfect. Shot. Oh my gosh, I can't believe we did it. Shot. You guys are the best. Honestly, I don't believe anything those other people say about you. All right, you're all good. Relax for a moment. Everyone relax. You guys did great. So 2, 3, 4, 5, 6. All right, just take your time. Take a break. Do you know what you need, Luis?
Huh?
You need vacation. You need a vacation. You need vacation. Anybody know what movie that's from? That's a tough one. All right, lateral. That's good. Let's get a discogram juice. We're going to do our discogram at 5, 6. Let's see if anyone can figure it out. Shot? Oh yeah, that was good. You can see the die came out. Let's get a good pull. All right, let's get a good pull. Here, I'll do it. I'll do this and shot. We should be able to get a good shot. Let's clean that up down there. Yeah, okay, that's pretty good. You can see the die going out the crack in the back. And give me an AP. Coker. You can relax. Remember, always come off slow.
Yes.
Shot. Bam, look at that. Die going out the foramen. See it way over there? It's crazy, huh? Looks like a mustache over in the foramen. All right. Now we got to advance this. I will need a little more help when you get ready. Shot. Let's see what we can do without your pulling. That's pretty good. Yeah, nobody needs to do anything special. Shot. That's about as far back as I can go. Let's get the tube down. Okay, nobody knows the name of the movie, huh? This is honestly one of my favorites. It's a sleeper. Nobody knew about it. It's one of those kind of movies that were produced where for some reason it never made it big. But it's got an all-star cast. Anybody know? It had Demi Moore. It had Chevy Chase. Dan Aykroyd, shot. And this is back when they were very famous. Everybody knew who they were, shot. It had John Candy.
California Vacation.
Nope. Shot. It's a movie called Nothing But Trouble. Nothing But Trouble. It's funny because nobody knows about it. Look it up. Watch it. One of the best sleepers out there. Nothing But Trouble. I don't know if it's on Netflix. I watched it 20 years ago when it came out. It actually has a musician, a very famous musician. As a matter of fact, It's an 80s movie, and it has an 80s rapper. A famous 80s rapper in the movie.
What?
What's wrong?
Huh? I just noticed. Okay. Yeah, we have right here. Krista, we have a bunch of towels.
Shot? All right, that's good.
There's water. Yeah, yeah, water on the floor, please.
All right, we're doing good, everybody. Yeah, there's just a little bit of water on the floor, no big deal. All right, let's get this out. Can you bring that out? You may need your special coker trick. The rapper's name is Dr. I think it was Dr. Dre. No. Who was the famous rapper in the movie? Can you look that up, guys? We need a Google moment. It's not Dr. Dre. I don't think it is. Flynn? Nothing But
Looking it
Trouble
up, sir.
cast. Huh?
Looking it up right now, sir.
Yeah, look up the cast and Nothing But Trouble. Anyway, great movie. If you haven't seen it, very funny. Very kind of a bit weird. I think that's why it never really got popular. The setting is these coal fields that are burning in the northeastern United States.
The rapper's name was Tupac.
Tupac?
Yes.
No, it's Tupac, right? My gosh, I didn't realize it was Tupac. Great movie, though, seriously. Demi Moore, Tupac, John Candy. Who? Yeah. I mean, great all-star cast. Shocking that it didn't do better. All right, we are at 5-6, and look at this. We're seeing more of the softer disc herniation here. Yes, this is definitely some old stuff. I agree. But there's a lot of fresher. Look at that. That's a fresh herniation right there. So this disc definitely needed to be done. I didn't realize it was Tupac, but now that you say that, I think it was. Because in the movie, if you watch the movie, he's in disguise. He's got this weird nose thing, a fake nose. So that's why it's hard to recognize who he is. Oh, look at that little herniation down there, just sticking his head out like a little gopher. Okay, so disc number 2. We're on our way. Again, no movement. Absolutely no movement of these bones. And we're going to change that. We're going to give them about 2 degrees of movement by the time we're done. That's my guesstimation. If you like comedies, it's a comedy movie. None of you guys have seen it? It's hard to believe, huh? Louise?
I don't remember seeing
Oh my gosh, sorry.
I want to watch it now. I love those actors.
Yeah, oh man. It's weird, but very funny. It's weird funny. Like not perverted funny, just good, clean, weird funny. Saturday Night Live skit funny. Anyway, one of the actors, I think he's Cuban or Puerto Rican, and he's telling Chevy Chase, "Do you know what you need? You need vacation." They're Brazilianaires, that's what it is. They call them Brazilianaires. They're from Brazil and they're billionaires, Brazilianaires, right? It's just the silliest damn movie. Anyway. Here we are at the back, a lot of bone spur, a lot of scar tissue, not as much as the last disc for sure, but definitely abnormal. And got to clean up as much as we can back here. Get the pressure off the spinal cord. You see that herniation just kind of undulating down there? See it? It's like rolling around. That's just sitting on top of the spinal cord. It's calcified. There's the uncinate process. We're kind of looking out the foramen already here on his left. That's how well placed the tube is. So we're going to have to work our way back to the other side. See how we get a little bit of movement? We got about 1/2 degree. And I'm just going to remove all this herniation here. It's all scarred up. We call it collagenized when it's scarred up. This is old. So we got a mixture here of old and new. This patient has herniated this disc, probably 30 to 50 times over his lifetime. And each herniation has its own age. You know, the birth of a herniation, it has its time. And this part here, down here, is like really old. Really old, like 15, 20 years old. Easy. And then we saw some fresh herniation. So the really old herniated nucleus pulposus, it won't stain blue. But the fresh stuff does. Look at that fresh piece right there coming out of the hole. So you got a mixture of old, like 30 years old, 40 years old, and you got new. This is a giant wad of herniation right there. We're going to have to work on getting out. Right, Luis? What's our last patient? So 3 level. All right. Man, this is so bad. Sunday. Yeah. Have you heard from him? The Australian that we did on Tuesday? Yeah, he's doing amazing. His pain is gone. He even did a testimonial, which I think you're going to have those testimonials done, right? Kevin? Is Kevin over there?
Yes, sir. They will be out tomorrow.
Awesome. Those will be your last testimonials for us. Oh, look at that herniation. Just blew out of that crack down there. That's amazing. That's an old one, guys. Look at that. Smooth surfaces. It's been worked on by inflammatory inflammation for years. There's another piece that's newer, still blue. The deep, deep blue staining stuff is fresher. The faint blue is older. Because remember, collagen, once a herniation gets collagenized with scar tissue, it doesn't stain. Scar tissue won't stain the blue color. So the more scar tissue, the less blue. The less scar tissue, the more blue. The older, the less blue. The younger, the more blue. Any questions from the audience so far? That is an ugly foramen.
Not yet, but a lot of praise.
Oh, wonderful. So if you're watching, you guys can all ask questions. Feel free. If it's a point in the surgery I can answer for you, I'll answer. If it's too tense, I won't. But so far, surgery's gone pretty good. There's the arthritis here is worse than I expected, but the surgery is going better than I expected. So if that makes any sense to you, great. So this patient is actually from the Northeast. He has a lot of family and friends watching from the Northeast. Does anybody remember exactly where he's from? All right, well, we know he's, let's just say Pennsylvania, because I don't want to give out too many details. Yeah, so he's from Pennsylvania, and he's been watching our surgeries for a long time and contemplating getting this procedure done. And, you know, smart, very smart patient, the kind that I like, because they ask good questions, they understand the way it works, and the truth is that they realize that not every surgery goes perfect. And so by us broadcasting our surgeries, we show them, hey, these are the kind of problems we have during surgery. You know, this is the kind of challenges we have to overcome. And so he was really on it when he talked to me. He's like, even before he came down here, he was saying, what about fixing 4 discs? Can you do it? What about my disc? There's a lot of arthritis, bone spurs. I said, yes, there is, but it's still worth trying. So, you know, I like an informed patient. My favorite patients are the ones that show up and say, I've watched all your surgeries. That's exactly what I want done. Sign me up. There's a piece of fresh herniation right there. See that? Pretty cool, huh? Seeing the old with the new. And that's what he took his time, did his research. This is all garbage right here, all arthritis stuff right here. The pink things at 3 o'clock and 9 o'clock, those walls are the bones of the vertebrae, the end plates. This is all bone spur right here. And I'm zapping away. It's like calcified herniation. So I'm going to open this foramen up. Now some people say, well, why do you need the laser? Well, the laser is able to remove bone spurs and calcified discs. It's able to remove everything down here that's organic. Lasers cut through steel. So people say, well, is your laser strong enough to cut through bone spurs? Yeah, absolutely. If I can cut through steel with the laser, it can cut through bone spurs, the hardest thing down here. And yes, this particular laser has melted steel. We've ruined many a tube with the laser, just melting the steel, the stainless surgical steel. You can see the blast marks on the side. That's posterior ligament right there. Posterior longitudinal ligament, a little bit of scar tissue here. But you see how the fibers run up and down, which is left to right for you guys? That's PLL. This is where the herniation was. I've cleaned it all out. I've shelled it out. There's just a little bit of scar tissue left here. And then we're done over here. So this patient doesn't have anything behind the PLL. Everything is on my side of the PLL. So this is good for me because it means I don't have to go near the spinal cord. I can just decompress below the PLL. See that bone spur just lifting right out? Oh, it's just a rock sitting right on the nerve. Just rolling out of there. Pretty cool, huh? These are all just calcified, sclerotic. This is the bone spurs you see on the CAT scans. Oh, the thing is just, it won't come out, but it's absorbing the energy of the laser, and I'm breaking it up in littler and littler pieces. But this is sitting right on the nerve. This is really a calcified, scarred up ligament in the foramen called the foraminal ligament. How are we doing on irrigation? Good? We're getting close to the end. Okay. You tell me when. Oh.
It's not a bug. It's between the fire van and the patient go in the, yeah. That's the process. Yeah, yeah, yeah.
That may be what it is. I think Luis is right. Well, we broke that thing up pretty damn good. That was a giant bone spur right there. So I've had people say, "Oh, it looks like you're playing a video game, Dr. Deuk." Yep, sure is. It's like playing a video game, you know? So you're welcome for playing all those video games when I was younger. Right? My mom always said, "Why are you playing so many video games?" So I could be a really good spine surgeon, Mom. Someday. Someday. I know it's hard to believe, but that will be me. Fixing people's spines. All right. I don't see any more herniations in there. We've gotten them all out. I always talk about gilding the lily, right, Luis? We don't want to gild the lily. You know? There are some people that just can't stop. And they end up causing problems by not stopping. They cause harm. And we don't want to do that. All right, I'm happy with that foramen. And I'm going to head back my way. This is endoscopic surgery, in case you're wondering. And unfortunately, I'm the only one in the United States that does it. There is a Dr. Joe, but he does very different. He goes through a foramen. I go through the disc. We call this transdiscal. Trans means across or through. And I learned this technique from the South Koreans. Ah, there's one. And I learned it from a German surgeon. And I took the basics of what they taught me, and I came in, I improved on it and made a better surgery. One that actually treats neck pain. They were just treating arm pain and weakness. And I treat pain. So it's a bit of a different type of surgery that I do. I'm just going to clean this foramen up a little bit, get rid of some of this stuff. This is his right side. He has weakness on both sides. Numbness, tingling on both sides. Worse on his left. So we're making sure that we treat both foramen. This is just still full of a bunch of junk in here. A lot of it I can get out and help him feel better. Look at how the laser just melts the bone spurs, though. Isn't that cool? There's just we call it no contesto, right? In boxing, fighting, no contesto. We're not contesting it, or is that law? No contesto. No contest. All right, do we have any questions from the audience? Or does everybody know everything already?
They know everything.
They know everything.
No questions.
All right, they're a lot smarter than me. There's another herniation right there. Look at that piece of herniation. That's beautiful. Come on out. We see you. You're not staying. We got news for you. We're not just going to leave you here. Let me see if I can grab it out with a grabber. Just about done with this disc. I need about 3 minutes more. Clean up that foramen and we'll be done here. I think I got it. What's that? Are you joking? Are you watching the surgery?
We're gonna probably try that. Yeah.
100% we're going to do at least one more level. The question is, are we going to be able to get the fourth level? That's the one I don't think we're going to be able to get, but I'm going to try anyway. Is your guy over there? He had to leave for his flight. So you're on your own. Are you okay with that? Huh? It is. I don't know why they brought a 9 II. 9-inch II. Why? I was like, come on. We don't use 9-inch IIs. We use 12 inches. Huh? Well, he probably said, what do you guys do? Pain management? Oh, we have 9-inch. But we do spine surgery too. So you need a 12-inch II for spine surgery on a fluoro. Anyway, we'll get another week of demoing with them out of it.
Is that way better than the old one? A lot of the programs are a lot better to use, easier to use.
Well,
We have a question from Regina on Facebook.
Regina, yes. Feel free to ask your question, Regina.
Is
We're-
this procedure very expensive, and what medical insurance covers this procedure?
Great question. So the question is this procedure very expensive? And I didn't get the second part. Did you hear what she said?
And what medical insurance covers this procedure?
What medical insurance covers this procedure? All right, Regina, great question. Is the procedure expensive? Yes. Spine surgery is expensive. If you find somewhere that does cheap spine surgery, you may want to consider not having your surgery there, because the equipment here is about $3 million and the facility is around $10 million. So, and that doesn't even include our costs of running the business. So spine surgery is expensive, unfortunately, it just is. Is it the more expensive surgery? No, it's far less expensive than a fusion, which would be an alternative. It's far less expensive than an artificial disc. Those kind of surgeries can cost $100,000, $200,000. In his case, closer to $300,000 for those kind of surgeries. So this surgery is far less expensive than other surgeries, like fusions and artificial discs, laminectomy, which, by the way, we do those as well. So I know the costs of everything, you know, and this surgery is the cheapest. Oh yeah, look at that. So of all the surgeries we could be doing, laminectomy and fusion and ACDF, artificial discs, this is the cheapest. And then what insurances cover it? I wish I knew. We don't know what insurances cover what. But there are definitely insurances that cover it. We get paid by insurance companies quite often. But which ones will cover it, which ones won't, it's literally impossible to know until afterwards, till we bill the insurance company. And only then do we really find out what they're going to pay. The problem is insurance companies don't want to pay for anything. And so they refuse to pay for a lot of the newer technology that's out there, because newer technology is less invasive and it's more effective. And whenever you offer patients less invasive and more effective, they want it. So they go from not wanting a fusion to wanting laser surgery. And when that happens, that they end up increasing something called utilization. And what utilization means is, if I recommend this patient fusion, if I have 10 people like him, fusion, 10 patients, I recommend ACDF fusion. Only 2 of them will have the fusion, because the other 8 are so scared of fusion they don't want it. So the insurance company only pays for 2 surgeries. Now, if the insurance company covered laser, then I offer the same laser surgery to 10 people. All 10 people, actually maybe 9 out of 10 would get it done. So now 90% of the patients will do the surgery. Whereas with fusion, only 20% of the patients will do the surgery. And that's how the insurance companies see it. So if they cover less invasive surgeries, like laser surgery that we're doing right now, then more people will get the surgery done. And they don't want to pay more people for more surgery. So they would rather pay for 2 out of 10 fusions because it's far cheaper for them than to pay for 9 out of 10 laser surgeries. And that's how insurance companies think about it. Unfortunately, the patients are the ones who suffer as a result because they don't get the medical care they need. Yeah, this is the best surgery in the world for any kind of disc problem. Herniated disc, bulging disc, ruptured disc, degenerated disc, all the disc problems, this surgery is by far the best. It's all natural. There's no metal, there's no fusion. The whole surgery is done with a little hole in the skin. There's no scar tissue. We've had 0 complications and 1,400 surgeries from the actual surgery itself. So it's the safest surgery out there, and it's the most effective surgery out there for a herniated disc, bulging disc, or degenerated disc. It's pretty much what 99% of people have, are those kind of conditions. So it also treats spinal stenosis, cervical spinal stenosis. So it's really an amazing procedure. Alrighty then. Now, I have to go a long way back down here. Let's just try. We're going to try for the bottom disc. I need inline traction. Give me 1 second. I don't want anyone doing anything just yet, okay? So the first thing I'd like to do, I want to think through this because we have a complicated situation here. Jordan, are you happy with the position of your scope? I'm not saying there's anything wrong with it. I just want to know if you're happy with it. Just a smidgen. All right. All right, now everybody get in pulling positions, inline traction, please. And the first thing I'm going to do is I just want to see if we can see that 6-7 disc, because that's going to be the determining point. And I think we can, right there. So I think we should go for it, guys. All right, everybody stay where you are. Here we go. If I couldn't see that disc, I would say no, we're not doing this. Shot. I felt this pull out. Shot. Yeah. Everyone stay. Shot. I'm almost out. Shot. Yeah, that looks good. Stay there. Everyone stay where you are. Nobody move. All right, Luis, I'm struggling to get this up and out. Shot? Yeah, it just feels like it's grabbing on the dilator. Shot? Maybe there's a little tissue in there. All right, just about there. You know, I gotta say, I'm not gonna say anything yet, okay? But kind of impressed with the scope already. All right, now everybody ready? Everyone satisfied? Shot? I've got to see that disc space, so here we go. Nobody do anything, stay where you are, here we go. Shot? Shot, almost there. Can feel I'm right on the cusp. Shot? Okay, I'm out. Question is, can I make it down there? Shot? It's pretty tight. Shot? Give me an AP. Stay where you are, everybody. Stay where you are. Almost done. Might get this, might not. We're 50-50 right now. Stay where you are, everybody. I need an AP. Shot. Okay, it looks like we're off to my side. Give me a true AP quick. Shot. A little more. Huh? A little more, a little more. Shot. So his neck is just rotated. So we're still in the middle, which is pretty cool. All right, everyone stay where you are and go lateral. This will be our last push. Let's see what we can do. I just feel some resistance and I don't want to overdo it because 4 level with 1 incision. Shot. Shot. Feels like there's just a big bone spur here. Shot. Can you show me that disc a little better? I think I'm on it. What do you guys think? It's too, I need it less exposed maybe or something. I don't know. Yeah. Give me an AP. Give me the mallet. Hold on, not AP yet. Let me just, yeah, hold on. All right, give me the AP. Let me move my hands. Shot. That's still middle. Lateral. Could be a little bit off to Luis's side. Just a little bit, but it's not terrible. I just need the best lateral we can do. Oh yeah, I see that I'm right on the bone, that's why. Shot. Shot. Yeah. Well, what in God's great earth is that? Huh? Is that a bone spur? Shot. Shot. Is that my shot right there?
Yes, sir.
Is that a giant? It's just a giant bone spur, right? Give me an AP again. Sorry guys, it's taking a little while, but I want to get it right. Shot. I just need to see if I'm in the middle. I am. Perfect. Lateral. Unfortunately, you can't really see the disc space well on this AP, but let's see if we can just clean up that lateral view. And we're almost there. There it is. Shot. 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 I just can't believe it. All right, AP, let's confirm. Everybody stay where you are. We're almost done. 30 seconds. Raytech, yeah. Raytech. Shot. Shot. All right. Let me go back to a lateral. Let me see. I wonder if I can bring this back. It's not terrible. Depends on how in I am. Shot. I'm not really in, so I need to come back up and over to the side. Shot. Amazing. Shot. 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 There's a big bone spur here. That's what you're seeing on the MRI, right?
Yeah.
Give me another AP. There's just too big of a bone spur. Shot. At least we're in the middle. Back to a lateral. If I could just get one more clean lateral, I'll do one more try. And let's see if we can't get it. Shot. That's it. If I can just get it. It's hard though, shot. It's bone spur. Yeah, it's a huge spur. I know, but I'm just seeing if I can slip around it. Here, I think I got it. Shot. Too far low. Oh, that's shot. I got to see that other bone better. All right, AP. You guys are doing great. I apologize it's taking so long, but this is our last shot at getting this done right. And maybe I'm past the bone spur right now. Off to my side, that's the problem. Stay where you are. Shot. This is one of the biggest bone spurs I've ever dealt with up front. Shot. I want to be a little more midline. Shot. Lateral. Luis, you're going to need a jacuzzi after this. I'm in the midline, but I am like far away from that disc. Shot. I need one more AP. Yeah, it's deflecting. I have to see if it's deflected or not. I'm good. Hey, shot. That's not bad. It's right there. Lateral. Shot. Shot. That might be it. Give me an AP. Let's see where we are. If we're in the midline, then we're good. Yeah, we're good enough. Just off to the side. All right, good. Lateral. This should be it. And give it to me. I can't believe it. We got it. That's crazy. I feel the prayers, folks. I really feel those prayers. Shot. He said he had a lot of people here watching and rooting for him. Well, our prayers so far have been answered, and I appreciate it. That's it. I can't believe we got it. We're not going to be able to do the die. I already went past the middle. We'll try. Let's try it. It'd be good to visualize the herniations if we can do it. Shot. The visibility down there is just so poor. We're in the 6-7. I never thought in a million years we'd be able to do this. So once I saw his neck in the operating room, so miracles do happen. Yep, he's going to be bruised up a bit, but I think it'll be worth it for him just to get it done. Shot. All right, we will need some better visibility here. I need a shoulder pull inline traction, please, doctor. Shot. Yeah. Wow. That tube is anterior. Stay where you are, everybody. We're going to have to deliver this down. Shot. 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 This is the hardest I've ever done. The hardest case I've ever done. Just give me another minute, guys. There's no doubt about it. 10 seconds. Shot. That's it. All right, good work. He's got dish. He's got a short neck. He's got a thick neck. He's got a severely collapsed discs. On a scale of 1 to 10, his dish is an 8 out of 10. His disc collapse is a 9 out of 10. His neck shortness is a 9 out of 10. I mean, every difficult thing that can happen we've encountered here. Well, we're good. We're good. We don't need another shot. No, we're good. That's good right there, actually. That's nice. Yeah, thank you. My hands are tingling from trying so hard. I'm sure Luis's arms are tired. Yeah. Do you know what you need? Luis, you come over and use my hot tub if you want. Okay. All right. Huh? You need one for your house? Maybe able to arrange that. Whoa, what's pulling? What's pulling? That was weird. Oh. Okay. For those of you watching, we made it into the 6-7 disc, which was, honestly, we weren't even thinking we'd be able to, but somehow we did. So let's get on with it. Going to do this disc and then hopefully 3-4 and we're done. Well, we weren't able to do the discogram here. But that's the herniation there. That's the space between the two bones. We were talking about our sacroiliac joint fusion, which we did that surgery earlier today, and that patient already went home. Oh, yeah. And she was very happy when she left. Said her pain was gone in her SI joint, but she had a new pain, of course, the pain of my surgery. So I figure that'll take a few days to go away, and then she'll be doing really well. All right, so we're looking down at the crack here. The crack is where the herniation is. That's the herniation I'm removing. It's very, very calcified, very, very scarred up. It's not blue because I didn't stain it blue. I didn't put that blue dye in. We just got, you know, it was so challenging to get the tube in, I wasn't able to do the discogram properly. So we had to forfeit the discogram, but we got the big win instead. So we lost the touchdown, but we won the game. All right. This is all scar tissue here from chronic inflammation from the herniated discs. So, how is our patient, doctor?
Doing very well.
Stable?
Perfect.
Oh, I'm so happy. That's wonderful news. There's a big old herniation right there. Let me grab that one out. I don't think I got it. Try one more time and If I have to, I'll just go in there and break it up. Got another piece of it out. Scope on. Questions from our audience for this surgery, or any surgery, as a matter of fact. We offer the audience an opportunity to ask me questions live while I'm doing surgery. Most of the time I can do two things at once. I can operate and answer questions. So I don't mind answering questions as long as the case is going well and I have the ability to answer the question. Feel free to ask away.
No questions currently, doctor.
Your volume is super low, Glenn.
No questions currently, doctor.
Thank you. Why don't you run the video on the procedure we're doing, called the Deuk laser disc repair, so people can understand exactly what I'm doing down here with the annular tear and the herniation.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. We are still working at C6-7, the bottom disc we're supposed to fix today. And for those of you who joined us a little late, we've already completed the number 4-5 and 5-6. We found tremendous arthritis. On a scale of 1 to 10, it's a 10 out of 10 arthritis. And cleaned almost all of it out at those two discs. Now we're working on the bottom disc that we're fixing today, 6-7. This patient has injured all 4 of his discs. All 4 of his discs are in really bad shape. People ask me all the time, can you do the Deuk laser disc repair for a degenerated disc? And the answer is yes, for sure. We do it for degenerated discs, we do it for herniated discs, we do it for bulging discs. Any kind of disc injury in the spine that's symptomatic, meaning causing either pain or pinching a nerve, causing arm symptoms, leg symptoms, thoracic radiculopathy, we can treat it. So this surgery is for any painful disc, any symptomatic disc. It just doesn't even have to be painful. It can actually be pinching a nerve and causing weakness in the legs or arms. And if that's the case, this surgery is wonderful for that. There's the foramen. And I'm just going back and forth, keep flipping the view. I work one side, then I go to work the other side. And what's happening is as I'm doing that, I'm removing all the scar tissue and bone spurs that are basically holding the bones together, almost like cementing them together. Sort of like rust will hold 2 metal plates together and keep them from moving. So we all know what rust is. Rust is something that forms over time, and yeah, it's like environmental inflammation. I like that. That's a great description. So this is like damage to the disc that then cause all this reaction back here. Thank you. And the reaction is what we call inflammation. And that reaction is actually what's causing all the problems for the patient, usually. Thank you, Jordan. Great job, by the way, Jordan. Great attention to detail. That's a big herniation back there. I think I got part of it. Go back in. Thank you. I told you it's big. Still some left. I'm going to bisect it. Cut it in half. Bam. There's one half. Out. There's the other half. Out. I call this the magic wand. This blue laser is like a magic wand. You know? And my spell is get rid of the herniated disc spell.
Bought it from
I got it. Yeah, I got it from Universal Studios. You know, have you ever been to Universal Studios? To the Harry Potter area?
Me? Oh yeah.
Yeah.
Oh yeah.
No, they've got like a store where they sell wands, right? And as soon as I saw that store the first time with my kids, I thought, oh God, I already know what's going to happen. They're going to want one of those wands. You know what I mean? And they're like $30, and it's like, really? You're going to make me spend $30 for that stupid one that you know is not really magic? Come on!
You can use it over there to whip people and I don't know. Something
To whip
there.
people?
Yeah.
You use your wand to whip people?
Well, yeah, me, yes.
That's what I'm talking about. Luis is scaring me. I know you got that hot Latino blood, but I didn't know it extended to wand usage. Right? They've got your face up at Universal wanted. Wand whipper. This man has abused wands far too many times in our theme park. No, one time I did get in trouble with the Universal Studio police, you know, their security. They had a security checkpoint. We had just finished dinner, and we're literally with my entire family, the kids, grandparents, everything. My brother-in-law, my sisters, their husbands, huge group of us, clearly family. And they're like doing a full-on TSA search. And the guy wants to pat me down, and I said, "What is this? You guys think you're TSA?" They didn't like that. They gave me a hard time. It's like, all right, the federal government messes with you at the airport, right? And they pat you down. So what? Now Disney thinks they can do the same thing? You know what I mean? I'm coming here to ride on your roller coaster and spend money buying expensive Diet Cokes that are like $6 for a Diet Coke, and you want to pat me down like on the Unabomber? I mean, are you freaking kidding me? I mean, maybe if I had a black hoodie and a backpack, you know, I could see it. But I walk in there with my, you know, Robert Graham color shirt and my bubbly personality with my kids and grandkids and nephews and nieces, and they want to give me a hard time. It's like, come on, man. No wonder why Disney's going down. Oh, look at that herniation. That thing is massive. Look at that thing. It's like Jabba the Hutt of herniations. That's supposed to be funny. I didn't hear enough laughter in the operating room. I'm getting a little concerned. Are you guys unionizing on me? Oh, there it is. All right, good job. We're just about done with this disc. Then we're going to move on. Believe it or not, to the last one.
That's a big one.
Anybody here go to Orlando regularly for entertainment? Huh? You said no?
Not me.
No.
Recently,
You do?
Not recently. No.
Oh, recently. One of the places I like is SeaWorld. They've got that water park.
For Aquatica?
Yeah. And they got this lazy river that's really nice.
Oh, yeah. Oh, yeah.
Have you ever done that? Yeah. The one at Atlantis? Try. It could be. Try the one at SeaWorld. It's just close by. But there's another herniation. Whew. I'm getting worn out here. Is SeaWorld fun? I think it is. They've got a pretty good water park. Probably not as good as Volcano Bay now. Oh, it's gotten better. No, they actually have they have a new roller coaster, right?
Oh, yeah.
It's called Icebreaker.
Yes, yes.
Yeah. Of course the lines are crazy. Why do you think everyone's drunk there? Well, I don't think she wants a job there. So if you don't like lines, then you just get that express pass. Listen, that's why I'm surgical. I go in just directly to the ride and then directly out. No. You don't want to deal with parking? Now you're starting to sound like a pop star. I'll have my limo drop me off and then James will pick me up at the exit. I'm sorry, but you're not that famous. I'm not even that famous. Point is, there's crowds. The best thing you can do is go on a weekday, like in the evening. You know what I mean? All right, so this is a giant herniation. I've been breaking it up into little pieces so I can deliver it. You know, my dad was an OB-GYN. He wanted me to be an OB-GYN. I said, there's no way I'm going to become an OB-GYN. But here I am delivering just like he did, you know. He said, I don't deliver babies, I deliver herniated discs. It's odd, isn't that? How that worked out? Wouldn't you say, Berndes? Look at this piece. This herniation is huge. It doesn't want to come out. Please. So these are all bigger herniations. They're just small pieces of a bigger herniation that can't fit out the tube, and you can see how smooth their surfaces are. Remember what a herniated disc looks like when it's fresh. It's got all that irregularity to the surface. And now these are super smooth, right? They're smooth because they've been worked over like a river stone by inflammation. I think we're pretty much done here. Just want to take one more peek, make sure we're not leaving anything behind. Maybe something right there. Oh yeah, baby. Come on out. Come to daddy. Come to papa. You got to make this stuff entertaining. If you don't, literally, you'll lose your mind. Right, Luis? Oh, are you kidding me? Come on. Yeah, right? He's found a friend. Yeah, we thought we were done. But no, of course not. What's that big white cartoon character? It's like a ghost or whatever. Not Casper. It's like the Michelin Man almost. You know what I'm talking about? There's a cartoon character. Someone help me. How's my irrigation? Trying to float these guys. We've used a lot. Well, there's been a lot of herniations to take out. Look at these things. They just non-stop. Let me try to grab it out. Got a little bit there. Are you offering Dr. Berners to use your sneakers? So one thing you can see if you're here is you can see all the little pieces of herniation that are sitting just outside this area that we're working on the patient's neck, basically. And that's another. Any questions for us? We're happy to take them and answer them.
Yes, we got a question from Ron on Facebook. Can you explain the difference between spinal compression and nerve root compression? Does one heal faster than the other?
Difference between spinal compression and what?
Nerve root compression.
They're the same thing. Spinal compression. Compression means to put pressure on something. And what's being put pressure on are nerve roots and the spinal cord. Spinal cord's in the middle, nerve roots are off to the side. So that's the only difference. There's spinal cord compression and there's nerve root compression. But it's the same thing. You know, spinal cord is just a big fat white thing in the middle of the spine, and the nerve roots are off to the side. But when we decompress whatever's compressed. If it's the nerve root, we decompress the nerve root. If it's the spinal cord, we decompress the spinal cord. Every patient's a little different. If you have a nerve root compression, you're going to have weakness in your arm, numbness, tingling in your hand. If you have spinal cord compression, you can have balance problems. You can have weakness, numbness, headaches, tingling in your hands, fingers. So the symptoms are quite similar. But spinal cord compression can give you balance difficulty and incontinence of urine where you're peeing on yourself or have to get to the bathroom where you might pee on yourself. Whereas nerve root compression never does that. Just about done. It was worse than we thought, again. I don't see any more herniations. I may have to get that little thing there. Let me see what that is there. I wonder if I can do any better. Yeah. One more push. Not easy, is it, Luis? Big chested guy. All right. That's it. That's all I can do. Great job. Scope is off. All right, let's irrigate a little antibiotic. And let's go take a look at 3-4. We're just cleaning things out. All right, we've done 3 out of 4 discs. We are going to try to get the last one. Bring the fluoro in. Go ahead. Yep. Great. No, that's great. Thank you.
After this, we don't have to go. It's up there, so.
Shot. Mm-hmm. What?
Yeah, Jordan can do it.
Shot. It's the weirdest thing, just sliding along that tube. You're done, I think. Let's see. Shot. All right, here we go. Move a little bit more north. Let me just get this out. Bring it up north. Shot. Need to see a little bit. Yeah, okay. Shot. AP. Nobody has to do anything right now. You guys can all relax a little bit. I just need to check the AP view. Wow, pretty good. Shot. Uh-huh. Shot. Hold on. Shot. All right, lateral. Whew. Well, for those of you watching, this is the patient's face. He's looking up at you. This is his neck. The middle of the neck is right about here, where my finger is, up and down. His chin is right there. His chest is here. Is that my shot? No. Yeah, go ahead and do a shot. All right, yeah, 2, 3, 4. So I'm very close. Shot? No, that's not. No. Shot? All right, let me get a AP. Never. You know what I mean? Stay there for a second. Shot? All right, that's pretty good. Stay there for a second. It's just sliding. Shot? That's a little too much. Shot? Can you get me centered there? Are you centered? It's close. Try to get me the best center. The other way, maybe? Can you darken up the spinous processes? I see the spinous process. Stay there for a second. Shot. That's better. That's a little too much. Shot. Lateral. Perfect. Lateral. Yep. So we got Mount Vesuvius to climb. Here we go. Ray? Ray Tech? No, I don't need you to do anything. All right, so it's got a massive bone spur there. Shot? 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 Oh, that is big. Shot? Give me an AP. Coker. I'm on what feels like the disc, but I can't tell if I'm midline or not. Let me know when you're ready. Shot. That looks pretty good. Wait. Let's try that. Hold on. Shot. That's even better. Yes, it's better. Give me a lateral. Phew. Let me have the pipe cleaner. Shot. Uh-huh. What? That is shot. Huh? Let me have a mallet. Shot. That is insane. Shot. I just want to say, literally, Coker, AP, on a scale of 1 to 10, this is beyond 10. Beyond 10. Honestly, beyond 10. This is like a 12 out of 10. I've never said that before. All right, try to get that lined up even better. It's pretty good, but I want to slightly better.
It's like landing a 747 on an aircraft carrier.
Yeah. Right? All right, that's good. I mean, to climb that mountain and find the little volcanic opening and
all through one incision.
oh, and not slide left, slide right, slide up, slide down, like one incision. 4 millimeters, folks. This is history. You're watching history at Deuk Spine. We have done 3 discs before with 1 incision. Today we did 4. And we've never done 4 with 1 incision in the neck. So, shot. It's pretty good. It's always good to make history. Shot. Well, no, I mean, SI joint fusions have been done by many people. We didn't do anything historical there. I mean, it was our first one here, but yeah, yeah. Shot. Yeah. It's another horrible disc. Extremely inflamed. Shot. All right, we're pretty much there. Oh. Sorry, Luis, you had so much dye there, didn't you? We could have a dye party. Sorry about that. I try to remember too. Well, this is definitely history. 4 cervical discs, 1 incision, 5mm incision. We've lost probably 10 drops of blood, maybe a cc. So imagine a 4-level ACDF with all the blood loss, scar tissue, trauma, and none of that here. You're going to clean that out, right? When you
Post-surgical healing time.
Unbelievable. Shot. Now, it would be good for you to help me here. A little inline traction. Let me know when you're ready. Shot. I gotta watch that dilator. I'm gonna bring the dilator back just to be safe. Luis, maybe you can help me with the dilator. I just want to pull it back a little bit. I don't want it to go forward, so I'll hold the tube. Just wiggle it back a little bit. Tell me when it's good. Yeah, shot. Mm-hmm. Shot.
Let me use blue towel also. Let me grab a blue towel. Yeah. There you go. Try.
Getting any traction? Shot? Nope. All right. Let me try to advance this. See, we'll just keep an eye on it. I think once we get in the disc, we'll be able to. Shot? Shot? Yeah, it's good. You giving traction? Killing me. You giving me good traction? Is he still relaxed? Shot. 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 Unbelievable. Shot. Making a little bit of progress. I'm biopsying the hell out of this Raytech, huh? Shot, that's better. Yeah, but that dilator is going in. I don't want it to go any further in. We need a wet towel or something. Do we need a vice grip? Why don't we get a vice grip just in case? It's coming? Shot?
Yeah.
Shot? Good.
I
I don't want it all the way out though. Put it
So,
back in.
let me know.
Shot? More. Come out. Let me have it.
Good?
Yeah. The key is the tube has to slide over it. You ready? Shot?
Does that help?
That's
Help?
beautiful.
That's good?
That is beautiful. Done. We're done. Yeah, the more you pull, the easier it is for us. Of course. That's why you do inline traction. All right, that looks really good. So this is 3-4, our last disc. We're going to bang this out in about 10 minutes, and we should be done. We've successfully treated 3 discs. This will be our 4th one. So hopefully this one goes nicely, and we'll be done. All right, so Flynn, what have we, what videos have we shown our audience? We've done the Deuk laser disc repair. We did the fusion versus Deuk laser disc repair, right?
Yes, and we have another comparison.
What's that?
We have another comparison that we can show.
You gotta raise your voice. I cannot hear anything you're saying.
We have another comparison that we can show.
Did you hear what he said? No, I can't hear. You said, I like, what? Another comparison video.
Yes, another comparison video that we can show.
All right. So when you're speaking, just speak slowly and speak in Chinese so we can all understand you.
Understood.
Or German. Mach schnell!
Kein Problem.
All right, good. Well, let's play that video. Oh man, it's so tight in there. Jeez, this is probably.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, 2 patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a ½ inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before release to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Welcome back. We wanted to show you another video Flynn ran for you. And we're just sitting here at that C3-4 disc, just making real slow progress. There's very little movement of the bones. I mean, I've been working on this now for a good 10 minutes and I have not gotten much movement whatsoever. So this is a very, very scarred together disc. And the amount of movement we're getting right now is like 1/4 of a degree, and it's more than anything we've had so far, so it's definitely an improvement. You can see the fibers of the posterior ligament down there. I'm really aiming out that foramen with my tube, trying to get as much exposure and visibility of the foramen over there as I can get. Clearly I've peeled the herniation off of those fibers and making a little bit of progress finally. You can see some movement now. Not much, but a lot more than we had earlier. Wow. Arthritis basically over time fuses joints together if given enough time. And the reason is arthritis is inflammation, and fusion comes from inflammation and destruction of the surface of the bones in the joint. So when you combine the destructive power of arthritis along with the inflammatory power of arthritis, you get a recipe for fusion, basically. All right, I need 5 minutes. Just about done here. This is one of the most it's probably the most arthritic disc I've ever done. Easily. Check this tube when we're done, Luis. I think it's maybe seen its last surgery. It's really stiff, and I don't know if it's just bent or what. We're going to be done in a few minutes, folks, so it's been a long case, and I appreciate all of you guys sticking around for it. I think he'll be happy with the results. I really do. I think we've accomplished a lot here. You can actually see movement now. It wasn't there before, and I'm happy with the progress we've made. That's the foramen. It's looking good. This disc injury is really old. This is at least, if I had to date it, I'd say at least 30 or 40 years old. So this is not responsible for any of his newer symptoms. It's one of the advantages of doing the surgery. I can go inside the disc and I can actually see how old the injury is.
You got injured a lot in football, you said 30, 40.
This is that football injury. This is the football part. You know, once you damage the disc, it's susceptible to re-injury. And this one here, this was just destroyed years ago. And so it really hasn't injured lately. in the last probably 5-10 years. So these injuries look super old and healed. I don't mean healed in a good way, but healed with scar tissue and bone spur. All right, just about done. 2 minutes, doctor. I've done everything I can do here.
Step off, lights on, please.
That's taking everything out of me. All right, we did it. 4 discs. Incredible. Like I said, I've never done 4 with 1 incision. This is a first, but it went really well. I didn't have any problems. The nice thing about his neck being so thick is there's a lot of soft tissues there. I need the suction on, please. No, it's not. It's still not on. We're waiting for it. There it is. Can we not mess with the suction until after we're done? I'm going to show you all just right here. You guys see this, Flynn? I'll need that. Can you see this? We need the light on, please.
Lights on, please. And then
Can you see this, Flynn?
Yes, sir.
The whole surgery, 4 discs were fixed with 1 tube, 1 incision, from up to bottom. All right, I'm going to show you this incision in just a minute. I got to take the tube out, and we'll be done. Okay? Remember, it was hard to get in, so it's going to be hard to get out too. I'm going to hold pressure as I always do, give it a few minutes, and then I'll show you the incision. And we're pretty much done, Doc. Nice job.
he's doing well.
Yeah, how was his airway?
But when I saw his neck, I thought it was going to be hard, you know.
It was hard because of his neck. Yeah. All right, you see this, guys? Can you see it?
Yes, sir. We can see
Yeah,
it.
the whole surgery was done with that little incision. He's a little bruised because we were like pulling, but my gosh, we did it. You got this? Thanks, Luis. Good work. Thanks, everybody. Good job. 1 more surgery to go. Should be a little easier. Like I said, our sacroiliac fusion's already gone home. So she did great. I expect this patient to go home in about an hour and a half. We had probably, what do we say? A couple of cc's of blood loss. Maybe 5. 5 mil. No complications. DLDR. If you have questions for me, type them up and I'll answer them for you. I'll be right there. Dr. Ardig Majan here at Deuk Spine Institute. It's Groundhog Day, I believe, right? February 2nd, so 2/2/2022. And I'm here with one of my patients who traveled from, where did you come from?
Tennessee.
Tennessee. And why would you travel from Tennessee to Florida to Deuk Spine Institute?
I have been miserable for months, and I found you and did a consult with you and knew this is where I needed to come for good treatment and relief.
And what kind of problem were you having that brought you to Deuk Spine Institute?
Severe lower back pain, which turned into sciatica, and it was down my left leg constantly. I slept about 2-3 hours a night at most, and I could not sit for more than 5 minutes, and I had to be standing up.
And did you try some other treatments in Tennessee or elsewhere?
I did. When this whole thing started and it was a bad flare, I thought I'll be able to work through this. Chiropractic, physical therapy, 2 spinal injections, massage therapy.
And how did you know those treatments did not work for you?
I had no relief at all. My sleeping continued to get worse, and my pain was never better.
And do you have relief now?
Absolutely. I would say I have 95% relief.
Awesome.
And it's amazing. After surgery yesterday, I put on a back brace. I walked out of here. I sat down yesterday for probably over an hour and had lunch. Last night, in bed, I had zero pain. It's a miracle.
Well, we're very happy that you're doing so well. And your surgery was a great one because we fixed 2 discs. You had herniated disc at L4-5, L5S1, and you can see in this footage right here that we grabbed the herniation out, and it was one of the herniations was really big, and it was really gratifying to get it out because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well, and I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Deuk and have him look at your MRI and give a good diagnosis. And if you need to have surgery, you come down here. He will take good care of you, and so will his team.
I really appreciate that. Thank you so much.
Thank you.
I'm Dr. Ari Deuk-Machen. It's January 26, 2022, and I'm here with one of my patients who you underwent the Deuk laser disc repair on your lower back for some herniated discs about a week ago.
Yes.
How are you feeling today?
Unbelievable. For almost 3 years, I had lower back pain, and it just, it just nags at you, wears you out. And then I came here, and you were the first one. I went to 2 other surgeons, and neither one of them picked up what was wrong with me, even though I had the MRI. And you came in, and you told me exactly what was going on, and you performed the laser surgery, and I'm like a different person.
Yeah.
A week later.
Yeah, you were a different person the next day, right? The day after, you had no pain, remember?
No, absolutely.
Yeah, so that pain's gone for the rest of your life. How does that make you feel?
New life.
Good. And, a long time ago, remember when people did something great, you said, what are you going to do now? They said, I'm going to Disneyland. You already went, I can see.
No, my wife's a big Disneyland fan.
Good for you. All right, so sounds like we helped you with your back pain, and it sounds like you're very satisfied.
Oh yeah, I'm recommending a friend of mine in Connecticut to come here. You have to come here. If you go anywhere else, I really think you're going to be wasting your time. So this guy just looks at you, and he can tell what needs to be done. He's a fantastic talent, and I'm very grateful that I came here.
Well, we're grateful you did too, because it's going to change your life for the better. Congratulations.
Thank you, Doc.
You're welcome. Good morning, I'm Dr. Deuk-Machen. I'm here with one of my patients, and you traveled to Deuk Spine Institute here in Florida from where?
New York, Poughkeepsie, New York.
Awesome. And why did you come from New York to Deuk Spine here in Florida?
Because I heard that this was the best place for me to go.
What kind of problems were you having that you needed to come here?
I had lower back problems and numbness in my leg, which was my left leg. This was the best place for me to come.
Okay. So you had back pain, sciatica down your left leg, pain shooting down the left leg.
Yes.
And that was just yesterday, right? When you
yes,
had
that's
that.
correct. Yeah.
And what, do you still have your back pain today?
No more back pain.
It's gone.
Gone.
And is that because we have you doped up on powerful painkillers?
Nope. None
No,
whatsoever.
it isn't. Did anybody in New York offer you spine surgery to fix your back?
Yep. Yes, they did.
Yeah.
And they wanted to fuse it.
Yeah. And you've had surgery before. You had a microdiscectomy, and that helped you for a little while?
Yes.
But the symptoms came back.
Came back.
Yeah. All right, well, they're not going to come back this time. So what do we do to make your pain go away?
You fixed my back. did arthroscopic.
That's right, arthroscopic spine surgery called the Deuk laser disc repair. So leg pain's gone, back pain's gone.
Everything is gone.
You happy?
You did. Very happy.
You're smiling.
Yeah, I tell you.
Congratulations.
Thank you so much.
We did it all through a 7mm incision, just that big. And you can actually watch that video right here, an animation, to see what it looks like to do the Deuk laser disc repair.
A Band-Aid sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own.
So now that your surgery's done, what are you gonna do?
I'm gonna go home and enjoy my life.
Good for you.
Enjoy my life.
Congratulations.
I am very happy.
Anything you want to tell your viewers?
Other than this is the place to come, it's worth the travel.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid sized skin incision is made.
This is Dr. Arjugmajan, and I have transported myself out of the operating room and right into this seat so I can talk to all of you about the surgery we just completed. And it is a historical surgery, no joke. First of its kind in the world. Literally the world. Nothing like it had been done before. Why? Because we literally fixed 4 discs in a man's neck with an incision that's 4mm, that big. So one cut, normally I go up 1 disc and down 1 disc if I'm lucky. I actually went up 1 disc and down 2 discs with that same incision. So yes, he had a lot of soft tissue, and there was kind of a deeper from the skin to the spine, so I was able to play with it a little bit better and pull the dilator down and get access to the bottom disc at 6-7. But honestly, we are using a new fluoroscope this week, and that new fluoroscope is the best fluoroscope in the world, created by Siemens. And Siemens is a German company. They've been making medical equipment for many years. They make, in my opinion, the best medical equipment out there. It is also the most expensive, but it is quality-wise the best. We have a Siemens MRI scanner that is the top of the line in the world. We have Siemens X-ray machines. They're called fluoro machines. We have 4 of them here at the Surgery Center of Vieira at Deuk Spine, and this will be our 5th one. And this is the new generation. And I'll tell you, if I didn't have this machine here this week, I would not have been able to see that bottom disc, because this patient's shoulders are so broad and wide, and the neck is short, that the penetration through the shoulders and through the C6-7 disc would be impossible on any other unit I've ever used. So we're lucky. We had the one fluoroscope in the world that will allow us to do the surgery today, and it worked out great. So I was able to fix all 4 discs. Now, does that mean these discs are going to look normal on MRI? No. The discs that I worked on today are always going to be collapsed, degenerated. My goal was to make them symptom-free. And what symptom-free means is to take away the symptoms the patient has from the discs. And to do that, you have to treat the annular tear and remove the herniations and open up the foramen and get the pressure off the nerve root. So that's what I did today with the laser. We were able to do it on both sides for all 4 discs. So I opened up 8 foramen. I removed a lot of herniated disc fragments throughout the surgery. And overall, I was very, very pleased and surprised at how well the surgery went for him. And like I said, he has a lot of family and friends out there watching and praying for him. and I think those prayers were heard, and they actually guided me and my team, and we were able to get the surgery done. All right, we have some questions. I'll take the first one, Flynn.
The first question is from MD on YouTube. Will the arthritis reform over time? How might you slow that process down after the surgery?
Yeah, great question. So one of our astute viewers mentions, will the arthritis return or continue over time, and how do you slow it down? Yeah, it's a great question. So first of all, the arthritis is basically inflammation of the disc. And by removing the herniations in the back of the disc, we have definitely going to slow down that arthritis. The herniated nucleus material is the source of the arthritis. We got rid of that today. And there's not much nuclear material left. So I don't think there's going to be a lot of arthritis. It's kind of like, if there's a fire burning in a forest, once the fires burn the trees, there's no fuel left for the fire. So we got rid of the new trees that haven't been burned yet. We got rid of the source of the fire. There's really nowhere else for the fire to burn. So great question. I appreciate you asking, but I think the inflammation will basically die off.
The next question is from the same person, and he's asking, can you perform laser disc repair if you have rod placement and effusion in the lumbar spine and developing issues over time?
Yeah, thanks again. Great question. The name again was?
MD from YouTube.
MD from YouTube. Wonderful question. So let me grab this model. Here's a lumbar spine, and as you can see, we have some screws and rods. This is a typical pedicle screw configuration, very common when you do fusion in the lumbar spine. The question is, can you still do laser if somebody has a fusion? The answer is yes. If you have a fusion at L4 and L5, what's fused is that disc, but the other discs below and above the fusion are still mobile, and that's where the problem usually comes from. It comes from adjacent segment disease. So I can still fix the disc below and the disc above the fusion with the Deuk laser disc repair. Send us your MRI. If you'd like to have your MRI reviewed for free to see whether or not Deuk Spine Institute can help you, whether or not you're a candidate for laser surgery or any other treatment we have, then submit your MRI scan at mri.deukspine.com. mri.deukspine.com. We'll type that up right now into the dialog box so you all have that link. Do we have any more questions?
No, that was
all right, that's it for the questions. And if you haven't downloaded the Deuk Spine Institute app on your phone, it's free and it's very informative. Check it out in your app store, Deuk Spine Institute. Also, visit our website and our YouTube channel. We have over 2,000 videos, mostly surgeries. You can watch the whole surgery in high definition. Have a wonderful afternoon. We do have one more surgery coming up in about 30 minutes. Maybe make it 45 minutes. It will be a lumbar surgery through the lower back. 3 levels. We're going to be repairing L3-4, L4-5, L5-S1. This patient has 3 disc herniations, L3-4, L4-5, L5-S1, and right leg pain.